to fill out a sheet with your name and your address. If you want to put your phone number, you can, you don't have to. The reason being is that I'm going to call on the people who have these sheets, giving us these sheets, who live in my district. I'm going to call them first, because my belief is, as in all the other places, there are a fair number of people outside the district who are here, and they're very welcome to be here, but I first want to hear from my constituents. So, anybody shut up. And we'll get to as many comment sheets as possible. I would simply ask you if you would. People tonight are probably going to express an opinion that you find loathsome and you disagree with completely, whether you're from the left or from the right or in between. I would ask that in light of all the sacrifices, whatever questions or comments you want to make. On the subject of health care, I did think it was important that I give you a tiny bit of context for what I'm doing as your congressman and what I think is important. Right now, there are 3 bills that came out of 3 different committees in the House of Representatives. 3 different committees. And they considered dozens, if not hundreds of hours of testimony, hundreds of amendments offered by Democrats and Republicans, and they concluded their hearings for the time being. I'm told that those 3 committees work. The private health insurance companies operate as a monopoly. They are literally exempt from antitrust laws. They're the only industry in America that is exempt from antitrust laws, the private health insurance industry. And as such, I believe there needs to be some competition because our premiums are going up double-digit every year. But most of us like our policies. We just don't want to be in the grip of the health insurance companies without any way to deal with them. We want to have patients to keep their doctors under whatever plan is put forth. We want insurance to be portable from job to job. And if you lose your job, or you're fired, or you lose your job, or they go out of business, then you can keep your insurance policy if you continue to pay the premiums. Next, we want it so that if you have a pre-existing illness, you cannot be squeezed by Medicare and the private health insurance companies, and you talk to your doctors and they're going to tell you they're almost fed up enough to leave the profession, and they've told their children not to become doctors because of the hassle, heartache, the 40% more work they do, the less time they can spend with their patients, and the less amount of reimbursement they get. We want to keep the best quality health care, which means the best and brightest. Ladies and gentlemen, we have about 120 sheets.
Forceful push of this health care plan is the concern by Washington to cover all of these calculated uninsured people in this country. And you've recently now just thrown out a new number, which has gone from 44 million down to 47 million. Nobody knows where these numbers are coming from. And it seems like the taxpayers in this country are being forced to pay for a lot of these people who are unknowns. And it just seems totally unfair.
Well, we know that no matter what happens in terms of what's being discussed today in Congress, there are at least 12 million of that 47 million who will not receive health care under this bill. Why is it?
Why don't they want to have tort reform in the bill? I know you said yesterday that why don't they want to have tort reform in the bill? I know you said yesterday that you were for it, but when they tried to add it to it, I think it was a congressman from New Jersey that knocked it out on a technicality or some other reason that they didn't want to add it. And you spoke about doctors and how some of them want to go out of practice, and a lot of it, I guess, is for that reason. They're afraid of being sued. And on the other hand, insurance companies that are denying people coverage. I myself am a cancer survivor, and I was denied a test, a PET scan by my insurance company. Now, had I died not from that PET scan, I was under a RISA plan. I couldn't turn around and sue my insurance company. But I know members of Congress and their families can.
We're not in any different position than you. No, we'll be treated the way they're treated now.
You can't even ask them about their citizenship.
Here's your alternatives, my dear friends. The alternatives are to gaming of the system. As close as we can. Sylvia Ridley.
Officers and employees of government healthcare bureaucracy will have access to all Americans' financial and personal records.
Well, Medicare has that now, and your insurance companies have that now. And if you choose,
So I ask you this. The government runs Medicare, partially runs the post office, and runs Social Security. None of them are making money. These are the people who spend thousands of dollars for a toilet. Now, why do you think they would be able to run an insurance company?
as I recall, there was a guy on Wall Street who spent $16,000 for shower curtains. Guys are making $100 million. Guys are making $100 million. So I'm going to respond.